Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This month's theme is No Bones About It. Today's example is a 6-year-old female neutered cat who presents for a large wound on the left side of the abdomen. She was in the garden 7 days ago while the owner was using a handheld lawn edger tool and may have gotten too close. She has been in hiding since then. There is marked soft tissue swelling and a large defect in the region of the left inguinal area. There is both gas or air opacity with increased soft tissue opacity surrounding this region that is typically occupied by fat opacity. The margins of the skin are markedly irregular, and there is wet hair artifact also observed at this level. The peritoneal and retroperitoneal serosal contrast is within normal limits. The abdominal wall has appropriate distinction. The gastric silhouette contains several mineral foci, but is otherwise unremarkable, as is the remainder of the gastrointestinal tract. There is mild spondylosis deformans and intervertebral disc space narrowing present at the lumbosacral junction. Our primary conclusions for this patient are the large inguinal defect without radiographic evidence of abdominal penetration. We do also observe that there are small gastric mineral foreign bodies without evidence of mechanical ileus. There are no radiographic evidence of penetration of the abdomen by the laceration that is also observed in this patient. However, we cannot definitively exclude a small rent and therefore can employ the use of ultrasound to evaluate for internal steatitis or inflammation of the fat in the region of the wound. We can also evaluate for evidence of reverberant artifact if the patient is lying in a recumbent position, which allows for small volumes of gas to migrate to the non-dependent region, and we would evaluate for this reverberant artifact outside of luminal structures. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.